Atrophy. Reduction of number and size of parenchymal cells of an organ or its part is called as atrophy. Atrophy may occur from physiological or pathological causes. Physiological atrophy. So the atrophy is the normal process of aging in some tissues which could be due to loss of endocrine stimulation or from senile arteriosclerosis. Examples are atrophy of lymphoid tissue with age, atrophy of thymus in adult life, atrophy of gonads after menopause, atrophy of brain with aging, osteoporosis with reduction in the size of bony trabeculi due to aging. Pathological atrophy. The causes are, first one is starvation. In starvation, there is general weakness, emaciation and anemia. Second one is ischemic atrophy. So the gradual diminution of blood supply due to arteriosclerosis may result in shrinkage of that affected organ. Example is small atrophic kidney in arteriosclerosis of renal artery. Second is atrophy of brain in cerebral arteriosclerosis. Third one is disuse atrophy. Prolonged diminished function activity is associated with disuse atrophy of that organ. Example, wasting muscle of limb immobilized in plaster casts. The fourth one is neuropathic atrophy. So interruption in nerve supply leads to wasting of muscle. It's called as a neuropathic atrophy, like poliomyelitis. Fifth is endocrine atrophy. Loss of endocrine regulatory mechanism result in reduced metabolic activity of tissue. Example is hypopituitarism may lead to atrophy of thyroid, adrenal and gonads. Hypothyroidism may cause atrophy of skin and its adrenal structures. Sixth one is pressure atrophy. Prolonged pressure from benign tumors or cysts or aneurysm may cause compression and atrophy of the tissue. Example is erosion of spine by tumor in nerve root, erosion of the sternum by aneurysm of arch of aorta. The seventh one is developmental disorder. Example is cryptorchid testes due to incomplete descent of testes into normal scrotal